Okay, good morning, everyone. Today we'll be talking mainly in English, but I assume you all know. I still see rising number of participants, so let's see who is going to join. But we have got already 64 participants, and I assume some others will join. So good morning to everyone, but we will start because we were supposed to start at 9 a.m. First of all, it's my great pleasure to welcome among us Mr. Dr. Cédric OUANEKPONE, Nsoni Gango, bonjour, and he is our speaker today, who will tell us a little bit more about his experience in providing healthcare in IDP camps or refugee camps in Central African Republic. He will be talking also about his view on perspectives and challenges of the situation in the Central African Republic, and also about some of his personal stories and personal view of the situation, hopefully. But we are extremely happy that you joined us, Cédric. You're currently now in France. Unfortunately, it was not possible, given the COVID situation, it was not possible to welcome you face to face in Olomouc. But we must say that Cédric was willing to come and was very keen to come to Olomouc directly, but it was not possible. So he's now staying in France, where he's working in hospital, and hopefully we will have some time in this semester, maybe in April, in May, when he will be able to come to Czech Republic and potentially visit Olomouc as well. So thank you very much for accepting this challenge, Cédric. Also, it's a challenge for you to speak in English because this is your third or fourth, or I don't know how what is the order of your languages. So thank you very much for willing to contribute in this to us. And just a technical note for everyone. Today we will see how it goes, because the connection may not be too fast. So maybe we will today, on contrary to the yesterday's notices, we would ask you to turn off your cameras in case it's too slow. But just a couple of us may turn on the cameras just in case it's slow. Just a couple of us will have our cameras turned on, so it's not so inconvenient for Cédric to just stare in a blank computer, and he will see some faces and some reactions. So for now, you can keep your cameras turned on, some of you at least. But in case the connection is not good enough, we will turn off switch off our cameras, and hopefully it will help. So once again, thank you very much, Cédric, and now the floor is yours. So it seems it's slow already. We cannot hear anything.
Do you hear me?
Yeah, now we can hear you, I think. Hello?
Okay, I'm trying to share my screen.
Let's try and see how it worked. I guess you tried sharing the screen with Mr. Chovanec as well. but maybe with this amount of participants, it's more difficult now. Hello?
Hello, I'm hearing you. I'm trying to share my screen.
We can see the presentation.
You can see it.
Yes.
Okay. Great. So thank you very much for this great opportunity, and I'm so grateful for this presentation this week because
sorry, please go ahead.
Yeah,
we are just discussing with colleague.
Okay. I said that I would like to thank you, to thank your University of Olomouc, and all the friends in Czech Republic, especially Siriri and all the team, and Caritas also for this great opportunity that highlights my country, the Central African Republic, which is still going through a challenging humanitarian crisis and mostly forgotten by the world. So it is a great opportunity to talk about it, to raise awareness on this crisis, and maybe to work together to bring some solution. Yeah. So I'm going to discuss with you on challenges and perspectives in humanitarian health sector in the Central African Republic, and specifically on health care provision in IDP camps. I try to write a plan for us to discuss very well this thematic. And after an introduction, we are going to see the care health sector, the challenges, and I will give to the participant maybe 5 minutes to work with me on the perspective. I have some proposition, but it will be wonderful to hear from them also once they will understand the context, the health system of in Central African Republic and the challenges. And I will share also my modest experience in IDP camps during the tough moment of this crisis in 2013, and we will conclude. Okay, as introduction, I think that you heard since Monday everything about the context of the Central African Republic, how things are there, and I can just say that the Central African Republic went through civil war with an unprecedented humanitarian crisis since 2012. And currently, we still have a difficult crisis because we have election on December 27, and in particular context because the country is controlled mostly by 14 identified armed groups, so like rebels that take control of many regions of the Central African Republic, and we are still facing this challenge after the election. And as the rest of the world, we are facing also the pandemic of COVID-19. Yeah, we have fortunately 4,000 cases. Yeah, but many people are healed, and we had 63 deaths. And but it is a relative, because we know that in Africa we don't have many cases, but it is because we didn't test also a lot, because if you close your eyes, you cannot count the cases. So it is what we can say, but we can recognize that we don't have difficult cases like we have in Europe or in the USA. Okay, so I give some reference for people who want to check about the humanitarian situation of the Central African Republic. Yeah, we have a sum up from yesterday, February 2, about the crisis. And according to OCHA, which is one of the UN institutions, the United Nations Office of the Coordination of Humanitarian Affairs, work a lot in Central Africa about this crisis. They try to summarize the problem we have pertaining to this crisis. So to meet the most urgent needs in 2021, they think that 1,000,008 people around about are still in need, and we maybe need 400 million to assist them. And by 2021, we have currently around 3 million of people in Central African Republic. That means 57% of the population I need assistance. Yes. And in the last year, we have also many humanitarian workers that face violence. Some of them are dead for that. So it is a dangerous also situation for everyone, even civil population and also humanitarian workers. Yeah, so I give also the link to UN office so people can go and learn more about it. And what is the situation about the care health sector? Because if you want to understand what happened, we want to understand the level of this humanitarian crisis in the health sector. We need to understand the health system in the Central African Republic. Yeah, the national health policy is based on primary health care and the Bamako initiative. So we call it easily SSP or IB. Yeah. As just a reminder, in Alma-Ata in Russia, in 1978, we have a huge conference by WHO about the primary health care. The goal was to reach health for everyone in the world by 2000. Yes, by the year 2000. But unfortunately, we didn't reach it. And now we are talking about the sustainable development goal since 2000. Yeah. And I give also a link for those who are interested to understand what primary health care means. Yeah, so the governments around the world make a declaration at Alma-Ata to reduce, I think, the inequality among countries and within countries. So people in a rich country or poorest country can reach a good healthcare system. And the situation is also about within the country. If we live in capital city or other region, we can afford a good quality healthcare. That is the purpose of this statement of Alma Ata. And the initiative from Bamako initiative took place in Mali, in Africa. I think all the Ministry of Health in Africa met to Bamako and 9 years after Alma Ata statement to make an assessment and to see how in African context we can improve our health system. Because as you know, in Africa, we live mostly in community. Yeah, so it can be difficult to apply directly some strategies that work in some part of the world. So after this meeting, they publish what we call the initiative from Bamako. According to this initiative of Bamako, community can contribute to the healthcare because we understand that it was, according to Alma Ata statement, the government or the state must provide healthcare for everybody. But in Africa context, it was difficult because we can lack drugs maybe for 1 week or 1 month in some areas. So it is difficult for our government to afford and to provide this health care to everyone. So the African leaders thought that it was better to have a system that include community, so community can pay for the health care and also contribute to the management. So in every hospital, we have a management committee that is led by a community leader elected by the community. So it is not a matter of just for physician or for people working in public government, but it is a community problem. That is, and so this strategy is adopted by the government of Central African Republic also, and it is a core of our national health policy. And we have also other commitments like what I said before, the United Nations Sustainable Development Goals, the number 3, that talk about good health and well-being. And 10 years after the Bamako initiative, an assessment was made. I think we have Valerie Hyde that from Canada, who work a great document about the assessment of Bamako initiative. After that, we see that the African leaders and the government didn't contribute a lot to improve the health system. So some people, many people in Africa have the goodwill to pay for their health care, for their security, but they don't have the money because most of people live with less than maybe $1 a day. So in Abuja, in Nigeria, in 21, the presidents of African countries made a statement called a statement of Abuja to deliver 15% of the budget for the health. So you can understand that in Africa and in the Central African Republic, we have a lot of statements. I always say that we have good written documents, but the application pose problem, but we don't fulfill this statement. That is the real problem. Yeah. And coming to the Central African Republic, we have a pyramidal healthcare system. So we have 3 levels, and in both sides, we have the national level, the regional level, that is the intermediate one, and the local level. And this system has 2 sides. As I said, the management one and the healthcare one. So in management side, we can see national, national here, regional, and local. So it is for national level is for decision, that is the National Ministry of Health. And here we have the regional level, some directors that can decide in this level. And in local level, we have the responsible of the sanitary district and health centers. But in the care side, we have in the national level, the hospital universities. We have currently 4 university hospitals in Central African Republic. We have the national one, we have the Hôpital Communautaire, we have Hôpital de l'Amitié, and we have Hôpital Elisabeth Domitien. So we have 4 hospitals for all the countries, for high level. And in regional level, we have 7 regional hospitals around the country, and many districts and health centers in the local level. So we can see here the 7. My map is obviously old because currently we have South Sudan and Sudan, but the situation didn't change. We have the region 1, yeah, Umbelampoko. The region 2 is here, yeah, Mamberika Dei, and we have the region 3 here. Ouam and Ouampende, I think people from Siriri know it very well. And in the center, we have the number 4, and in the north, the number 5, and in this side, we can have the number 6, and Bangui is the 7th region of our health system. So the public health system includes 4 sectors. We have the public sector, that is the government one, and coming from the colonial system and from the military medicine. And we have the para-public sector. So the government and private sector can work together. And we have a true private sector for profit, and we have also the faith-based private sector. That is, those are the 4 sectors for our public health system in Central African Republic. Now we can talk about the challenges. I don't know if there are some questions or if I'm very fast, you can tell me. So. Yeah, John, everything was okay?
Yeah, I was just checking the chat. There's no question in chat, but everything is okay from my end. I don't know. Okay, just let us know the participants, students, and yeah, is it okay? So far? Good. I see some nodding. Yeah.
Great.
So far, so good.
So let's talk about the challenges. Yes. The first challenges for me is the human resources. Yeah, there is a lack of human resources. By human resources, I mean physicians, nurses, and everyone working in the health sectors. Coming from my experience here in France or in South Korea or in USA, where I was from some internship, I can see that we have many people working in the health sector. But this is a real difficulty in the Central African Republic. Let's talk about physician, for example. We have one physician for maybe around 100,000 people. So the gap is so high. It is difficult for a physician working in the Central African Republic to see, to do correctly his work, because he's every time overloaded by patients. For example, according to medical rules, a physician cannot check more than 15 patients a day. But if you work in our context, in our area, you can see more than 50 patients a day. Yeah, so it is a real problem. It is a real problem. So I think the first challenge of our system is the human resources. And we just have one medical university in the country, one university in the whole country, and so one department of health. And this department can train maybe 50, 55 or 30 physicians a year. Yeah, and so it is very difficult to face the healthcare challenges in this with this number. Coming to specialists, it is very, very difficult, because all the specialists are just in Bangui, in the capital city, Bangui. You cannot find a pediatrics, a OBD or a cardiologist in Boar, for example, or in Bozum or in Berberati. Yeah, they are all in Bangui. Even in Bangui, they are not. They are just a few. You can find maybe 3 or 4 cardiologists. Yeah, 5 pediatrics and maybe 6 OBG. So the need is huge. That is a real problem. And for example, in my sector, because I'm measuring in nephrology, you can find just one nephrologist for all the country, and he is in Bangui. So it is a real problem for this health sector. Now, so we have also an unequal distribution of health workers. As I just said, in Bangui, you can have maybe some specialists, but in the rural area, it is really, really a drama. Yeah, so we need patient needs to leave their area to come in Bangui, or to come even people have to leave Bangui to go abroad for some health care. So it is difficult if you don't have money. So there is no another option for you. And the sanitary infrastructure and equipment is so basic. But basic, it is difficult. I think physicians in Central African Republic are doing a great job every day, because it is difficult to find a good equipment and to work every day. So that is a real problem. For example, we just have CT scan last month, yeah, for the country, for all the country. So it is very sad. But this CT scan doesn't work for now. Just maybe it is for election, so people kick off the center, and the first dial is the center. But we don't have any workers, health workers or specialists in this field. Currently, we have maybe 3 doctors who are measuring in radiology, but it is not enough for the country. So you can imagine if someone need a CT scan. So fortunately for now, he can leave a rural area to come to Bangui and to do it. But just a few days ago, he need to go abroad, maybe to Cameroon or to another country like Senegal or France to do it. So it is very difficult in this side. And we don't have a structure to face the challenge of epidemiological and catastrophic emergencies. Yeah, we have a center of epidemiological emergencies, but it is not well equipped. So it is a real problem. In case of flood or COVID-19 or cholera or Ebola, just in the other side of our border in DRC, it is a real problem. So there is a challenge in this side too. In scientific research, yeah, that is a great problem, because the government for decades doesn't support this field. So we don't have accurate data about what happened in different field of the health. So this is a great problem, because even NGOs or humanitarian association cannot work very well if they don't have accurate data about what's happened. So they have to do their own assessment of needs, and to understand and to manage their project. So it is a real difficulty in this field. We have the health financing. According to available data, we have the government pay $7 for one person per year. So it is impossible to provide a quality healthcare for a country which does not have a health insurance system. Yeah, a health insurance system. We don't have family medicine too. So if you have a health problem, you need to go to the hospital and to the emergency unit and to start just the process. You don't have your own physician who can treat you or check what happened before to send you to the emergency unit. This is a real problem. Maybe for some civil workers, they can have some help in this field, or people working in private sectors, but it is not enough to provide quality health care. So we have also a difference on how the resources are used in the healthcare system. You can have maybe 50% of the health budget for the year that is used in Bangui only. But in the other regions, you just have maybe 18% of the budget. But we know that in rural area, we can have we have most people than in Bangui, but we use a lot of resources in Bangui than in the other regions. That is a real problem. And we don't have control on our drugs and vaccines. For example, now we are challenging the pandemic of COVID-19, but many people in the Central African Republic don't believe that COVID-19 exists, or so for some of them it cannot kill an African. Yeah, we have many problems. So it is a communication problem, firstly. But people are talking about the vaccine. They say that we understand. You understand the what people are saying on the internet about the vaccine. So in Africa, it is a real problem. But the key problem is that we don't have a strong system of control of our drugs and our vaccine, and to tell people that yes, we make an assessment of vaccine and drug and it is okay or it isn't. So people do everything based on rumors, and it is dangerous for the health system or for their security. And we have lack of drugs and products, yeah, for our hospital. We have also a big problem with the traditional medicine and the pharmacopy, because this is a great part of our resources. We can treat many people using traditional medicine, and I think many specialists think that because in Africa we used to treat people with traditional medicine, things like that. That is why maybe COVID-19 is not so severe in Africa. But this is a part of our legacy. But this legacy, there is a lot of problem on it. We cannot understand what degree of a traditional medicine we can use, and people use everything just without control, without a test. So it is a real problem, and there is a real challenge in this level too. The biggest challenge.
Sorry. Yeah? No, if I might just step in, because we have got already 2 questions, and they are related to the previous slide. So one is inside the question from Dr. Petr Želková. Hi, Cédric, what about Institut Pasteur in Bangui? I know that they do research and have some plans for pandemics, etc. Thanks.
Okay, thank you so much. I think Institut Pasteur is one of the biggest center for test and for checking in Central African Republic. I think it is the reference, the main center required by the WHO for COVID-19. But the problem is that many Central Africans cannot afford the test the Institut Pasteur can do in the country. We have also our national our national center of test, but this center lacks many products to do different kinds of tests. So Institut Pasteur remain the main center and work also very hard, I think, about Ebola, about COVID-19, and about the epidemiological diseases. But the real problem is that many people think that Institut Pasteur is for rich people, and they don't have the possibility to go to Institut Pasteur. That is the real problem. And I think Institut Pasteur helps also in the level of training. Yeah, training some biologists and many doctors work also there. That is the problem. I don't know if I answered to the question.
Thank you. If you have any other question related to this, otherwise we have got one other question. If there are so many people who are in serious need of help and it's available only one doctor, have you any free days? How looks your typical work week?
Okay, thank you so much. I think we have many difficult cases in our daily practice in Central African Republic. You can people can sometimes the real problem is that they think that it is maybe a mystic problem. It is not a healthcare problem. It is a mystic problem, but it is really a health problem because they don't have money, and they think that we don't have the accurate equipment to do the test and to confirm or to say that this is maybe a neurological disease or it is maybe a tumor. So people can say that it is maybe some things like magic, something with not somatic. But we do have many difficult and severe diseases in Central Africa every day. And my week as a physician is very crazy. It's really crazy because in Central African Republic, you cannot, if you are a physician, you cannot have rest unless you leave the country to go somewhere, maybe for 1 week or for 2 weeks. When at your home, people, when they need health care, they come and they knock the door. So even at night or in the morning, at any time, you have to wake up and to treat. You can have a child, you can have a senior who is sick, and you have to do something. That is the first aspect. So you cannot have a real family life. Yeah, it is difficult for that. And when I go to the hospital, if I'm in the rural area, I live inside the hospital, so I can work at any time. Because in a rural area, you don't have a surgeon, you don't have a specialist. So in our training, we have the luck to have the possibility to do basic surgery. So things like cesarean, things like hernia, we can do it, or appendicitis, we can cure it like a general physician only. Yeah. So in a rural area, you don't have rest. You have rest when there is no patient. But if there is patient, you have to work. And sometimes you can be just one physician, or you can just be two physicians for a big region, a big area. So a patient can come at any time, and you don't have a real planning for the week. There is no planning. Yeah, I think for example, here in Europe, doctors work a lot. So I can confirm they work very, very, very hard. But you can have a plan for a week, but in Central African, it is difficult to have a plan for the week. So that is the real problem.
Thank you very much.
You're welcome. Yeah. Okay. Can we continue?
Seems so. We don't have any other questions. If any of the participants just have any question, you can just unmute and step in, I guess. It's up to you, Cédric, if you want the questions rather at the end, or it can be also during your presentation.
I think during the presentation, it is very good. So it can be a kind of interaction, and it can be more enjoyable.
Good. So if any has any pressing question, just ask right ahead, and if not, if it can wait, or you can just post it in the chat, and I will then translate.
Okay. Good. So I said that the biggest challenge is insecurity. Why? Because insecurity, we just saw that the health system, healthcare system in the Central African Republic is fragile. So because of the insecurity is another burden on this fragile healthcare system. And with insecurity, that means war or flood or armed groups, rebels, we have an unprecedented humanitarian problem. Firstly, we know that in the local level of the pyramid we saw, we have many health centers who are remote from the high level. But if there is insecurity, it is very difficult for people to reach the health center, and more again to reach the national level. It is impossible for them. With insecurity, with civil war, we have people in the forest, we have people far from their home, so it is really, really difficult. Insecurity is the great problem. And as we saw in the beginning, even for humanitarian workers. So sometimes you can find Médecins Sans Frontières or some NGOs that close their units in some areas due to insecurity. But unfortunately, the national system doesn't work in this area controlled by rebels, by other groups. So it is difficult to have drugs, to have a vaccine, and to have even health workers in this area. So that is our great problem. Insecurity, I think, is the mother problem of our health care system in the Central African Republic. We have also a difficulty in making accurate assessments. Yeah, because as I thought before, we don't have scientific scientific publications. So it is difficult to have an accurate assessment on the needs of the population. And something we have with our humanitarian workers is that with this insecurity and this crisis, the healthcare is free in many areas. This is not this kind of things that doesn't match with the Bamako initiative, because Bamako initiative, which is the core of our healthcare system, call the population to contribute to make themselves their healthcare centers. But with the humanitarian situation, we have free healthcare in many areas. So in some areas, you can have free healthcare for maybe 5 years. That is very good for me, for the population. They don't pay anything in some areas to have healthcare. But the problem is that it is a negative impact on our health system, because after leaving this region, when NGOs left the region, the area, it will be very, very difficult for the population to restart, to pay for their healthcare, to make the center work. That is a real issue. And I think that people working in humanitarian sectors like NGOs have to take this point seriously, yeah, because it can be a way to destroy, the healthcare in the future. But maybe we will see it in the perspective. Maybe we can do something for that and to make that much better and work better for our population. And when we have NGOs and humanitarian workers also, they are focusing on emergencies. That is great, because in front of an emergency situation, we have to do our best to fix the problem. Yeah, but by doing so, we don't support also the healthcare system to be strong and to stand and to work, to stand up and to work for the population. Yeah, and that is why some data show the Central African Republic like a republic of NGOs and army groups, because we have many NGOs in some moments of this crisis, and nobody has control on them. And the problem that many NGOs can do the same thing, yeah, but currently, unfortunately, we have some kind of management, some kind of meeting among them, and to see that an NGO can take this sector, another maybe health sector, maybe food, maybe drinking water, yeah, to contribute together in this situation. That is why, but the real problem is that the government is weak. The government is weak, and thanks to these NGOs, people can survive. People can survive, because it is not a way for living, but I think people are surviving. And thanks to NGOs, which do great work, but we just need maybe sometimes to have some kind of control, some kind of management of who can do what, yeah, to make things work properly. So I think I can close this chapter about challenges, and I'm looking for a question, and maybe after that we can go to something like perspective, and I will ask participants to make some proposition about what they understand. They can give us like perspective. Yeah, because it is an exchange, and we have to learn also from them and to work together. Yeah. Thank you, John. If there are some questions, we can.
Okay, hello. I think Jan has just left for some other meeting, so I am somehow replacing. So hello, good morning, Cédric.
Good morning, Eva.
Yes, so nice to see you. And I think there are no questions as far as I can see in the chat. So maybe that's a last call for questions now before the break. Okay. If there are any, you can even pose the question like in person.
Okay.
But apparently there is no one interested now.
Okay. The question I have is simple. I think based on the healthcare system in Central Africa, we just saw, and based on the challenges, yeah, we come just to talk about what can be the perspective for a kind of situation, of a kind of a country challenging with civil war, with a huge humanitarian crisis. How can be some proposition of solutions? Yeah, that is the question.
Yeah.
Okay. So I think we can give maybe five minutes to people, yeah, to think about it. And I'm going maybe to play a Central African song. Yeah, maybe that can help to think.
that might be a good idea. Or we can even make a break and we can let people think during the break. I don't know what's your idea, because usually there is like a half an hour break around this time. So it depends on you, Cédric, if it's better to have a break now and then maybe like we can gather the answers after the break, or we can now give some time for answering and then organize the break after that, as you wish.
Okay.
We can maybe even set up some kind of a shared document, and during the break people can contribute there, like the answers. That might be as well an option.
Okay. This is I think we can go for that.
Yeah. Okay. Yeah. So I will send in the chat the link for the document. I will put the question there, and during the break you can think about it and you can put the answers there. Yeah.
Okay. Great.
Okay, so for now, for the students, like let's have a break and let's meet at 10:30, and you will see in the chat the link for the document.
Okay, great.
Okay, so see you soon.
Okay, I think that we have many propositions. That's very good. And I think I can see that all propositions are linked. Okay, that's good. Different stuff. Okay. Perfect. Okay, I think I'm going to give some comments on the proposition. Yeah, but participants can continue to send their contribution. There is no problem. Okay. I see stronger government. Yeah, stronger government. And I see also maybe try to choose responsible government who would care about people's health and so on. There is some famous person in car with good reputation as a president, for example. I could imagine Didier Drogba as a president of Ivory Coast. So if can have someone like him also, I think I maintain that on my proposition too. I will share with you. But instead of a stronger government, I think more about good governance. I think we need good governance on the health sector, not only but for the whole country. You know, if we are dealing currently with war and or difficult situation, it is about bad governance because of corruption, because of clanism. People try to put themselves before the country, so it is a real problem. And maybe we don't need just a stronger government, but a good government, that can work for everyone. And okay, I can understand stronger because we have many rebels who are there for the natural resources, unfortunately, and for many years, yeah, many governments try to discuss with the rebels, but we are still in the same situation. Maybe we need a strong government for that, for peace, for peacekeeping. I can understand that war or being strongest is not the sustainable solution for peace, but after many dialogues and mediations, I think we don't have peace. So it is possible that the government must take his responsibility to protect people, to protect citizens. So we need educate leaders, and leaders with a high sense of humanism. That is really important, because I think we have educated leaders in the country. The country is led by a professor. So I think we have many ministers, or even in the opposition, we have many great intellectuals, people. But the problem is that if they put themselves first before the common interest, this is a really difficult problem for the country. Yeah, and I see that, okay, Didier Drogba is not president. I think our friend is talking about maybe George Weah in Liberia, okay? Yeah, but he's still dealing with problems. Maybe it is a solution too, but I think we need someone who knows really the challenges, who knows the problem, and who has a plan, a plan to solve the problem, to fix the problem. I think we can have many help for other country, for other institution, but if ourselves we don't have a good plan, a good knowledge of the problem, we cannot face this problem, we cannot fix them. Yeah, that is what I think. Telehealth, yeah, it could be a solution, but the problem is that in Central African Republic, it is difficult to work on an internet. Yeah, I think some of you who went to the country can understand better this situation. And we just have, in some area, we don't have 3G. So I think it is difficult for the telehealth, but it can be a solution. Yeah. So we can work on it for the future. It is possible. Focus on better education. This is, I think, the key. Better education is what we need. I think focus on doctors' education, more better education doctors, and so on. Yeah, education. The main problem or the main consequence of the crisis we usually have in Central African Republic is that students, pupils cannot attend school correctly. And so all the system is destroyed because there is no education. Yeah, they can start for 1 month and there is war and there is a situation, people run away, and for 1 year, they can just attend, for those who have the chance, maybe 3 months or 4 months. It is really, really difficult. I can just give my example. I start the medical school on 26. It's supposed to end in 7 years. So that means 2013, but I complete my study on 2015. So instead of 7 years, I did 9 years for study. So it is a real problem. Yeah. So after that, sometimes you think a lot before to go for measuring. Yeah, you can say, but how am I going to get married? Am I going to have a job? And if you have a job, it is difficult. I think the problem we have good doctors, I think. Maybe we have something to add in their training, but we have good doctors. The problem is that they don't have a good salary. For example, me, I'm a civil servant since 2017. But what I can have a month with all the risk compensation, everything, I just have something like let me make the conversion. Yeah, $50, $500. $500 a month for a doctor. That is incredible. And unfortunately, you have many doctors, they are supposed to do many jobs or to work even in public, on private in the same times to sustain to support their family, yes, to live correctly. So it is very, very difficult. I think that is the real problem. And when we have NGOs, many doctors left the public government to go and work in NGO, because if you work in Médecins Sans Frontières or WHO in some emergency program, you can earn 3 or 5 more than a public doctor. So it is a real problem. And I think the government try even to tell to NGOs to not pay a lot their doctors, because our doctors can live to go there instead of to improve the situation of the doctor, because everyone can know that in any country doctors can live with a kind of salary. Yeah, so that is a real problem. Working as a doctor in Central Africa is a question of sacrifice. Yeah, so that is also, and this situation can promote corruption, can promote the doctors cannot be efficient in their work, because they deal with many things at the same moment. Yeah. Better healthcare. I think we need to make reforms in our healthcare system and to find what can work properly for the system according to the capability of the possibility for the population to afford the healthcare, and maybe we need a kind of health insurance. We can figure out on it and find something that can work for our context. Yeah. Learn people first aid, yeah, so they can help themselves in necessary cases. Yeah, I agree. I totally agree with it. I think people need that in our context. Yeah, establish a secondary medical nursing school. Yeah, I see also something in Sanga school providing medical programs. Yes, we have also this kind of school providing medical programs, maybe for nurses or from some technicians. Yeah, we have the Crossrail is doing the same thing in Bangui for maybe more than 5 or 6 years already. Yeah, but for physician or medical doctors, we just have one department and only in Bangui. So it is really a problem. I think yeah, medialization of CAR's health situation and claiming potential donate from other countries. Yeah, I think we need we need to talk about it, and I hope that talking about it today can spread the knowledge in this situation, and people can make the best. And I hope also that our leaders and responsibles can apply good governance skills to help the population to take advantage of our health care system. Yes, I'm thinking that's the best to could more educated doctors. Yeah, sure. Maybe the people can't pay for the health care, so try to increase more job opportunity. Yeah, that is. So that people can pay for it or reduce healthcare fees. But I know it is very hard and long term to realize. Yes, long term is the work, because I think people in Central African Republic are able to work, to feed themselves, to pay for their care, health care. But the problem is that they don't have peace. They don't have peace. Without peace, we cannot improve, increase job opportunities. Yeah, we can see, for example, in Bozum, population try, yeah, to grow food, and we have many activities organized. Maybe Father Aurelio will talk about it tomorrow. But if they don't have peace, how can they improve their capability to afford for their health care, for their food, for drinking water. It is really, really difficult. I think that is also a great problem. Yeah. A local medical center with trained staff, doctor attendance three times per week. Yeah, this is a great possibility too. I think we need it in our country. Better cooperation with NGOs on projects with long-term impact, for example, vaccination, training nurses, and other medical staff. Exactly, better cooperation among NGOs is important and can be a solution. And we need to work on the long-term process, on the long-term strategies, yeah, to solve or to fix this problem. But starting is already a good thing. We need to start. We need to give scholarship for students in health sector. Yeah, that is very, very important. Why? Because as the country is still going through crisis or through war, we can have some partnership. We can have the possibility to send medical students even abroad, or to create locally more medical studies for people to be trained and to be trained correctly, because after the war, what are we going to do? We don't need the war to stop to train our population. Yeah, because if we just focus on the peace building, it is not possible after. So after the war, we need to train before to start. It will be very, very challenging. So from my side, I think that it is important to find some kind of partnership, for some kind of scholarship to help students, even locally or abroad, to studies and to go back and to work for their country. On this topic, many people always say that, yeah, if people go abroad for studies, they don't want to go back and work for their country. It is not true. It is not true, because we have many examples, but I think it depends just on how we can manage this kind of scholarship, and how we can improve also the situation back home. We have some people who, even if they have opportunities to work abroad, they want to go back in their country to work. But even if today we have someone trained abroad who wants to who doesn't want to come back and to work, but we can remind that we have already trained someone, and it is better to work in your own country than to work somewhere. So I think we can manage and we can fix this issue. It is not, for me, a valuable reason, yeah, to not give scholarship to students to learn. Because having great doctors, well-educated doctors, is also a power for a government or for a state. So it is important, and we see that during this tough time of pandemic situation. Yeah, that is, I think it is all. And I would like to talk about mobile clinic. Yeah. this is a possibility too. I think with some friends, we tried this experience, and it works so well. And I saw the Catholic Church in Central African Republic with the Archbishop Nzapalainga doing that also with a mobile clinic for people living far or in IDP camps. It is really helpful. It is really helpful. I think for pregnant women living far from healthcare center, I think this can be an alternative with telehealth. Yeah, it can be more closely, and it can help a lot. Yeah, I think we treat all the proposition. Thank you for those interesting proposition. I will put it on my document and on even my own strategies, but I can share it also with in the platform of medical doctors, because we have a large platform of medical doctors from the Central African Republic, and it can inspire someone. Why not? Okay, so let's come to what I wrote about perspective. Yeah, I think that, as I told already, security is one of the most important things on which we need to work. Yeah, Siri, like Siri Ndio, it means peace in Sango, our local language. If we have peace, I think we can start and we can support everything. When we don't have peace, we destroy everything. And we are, you can see, like in some vicious cycle, so from destruction, for 1 month of peace, of fragile peace and precarity, and we go back to the trouble again. I think peace is a great solution for the Central African Republic, but I know that it is a challenging problem, and the problem we need the help of everyone to work on it, even local government, the population, and the international community, yeah, to make the right decision, yeah, to help people to be in peace. Because if we don't have peace, I cannot imagine how we can improve the healthcare system. Yeah, so security is really, really the pillar, you know, of this situation. We need health sector reform. The reform of the health sector is important to make it the easiest possible, and to help people to afford and to pay for their health care. So it is important to visit again what work, and to assess what work, what doesn't work in our healthcare sector. That is really important. And the government should make health a priority. We know that due to the pandemic, everyone understands that health is a priority. But we in Africa, unfortunately, many times most of the time we put a lot of money in maybe guns, something than in the health system, and that is a real problem. Yeah, we don't prioritize the health care system, so it is a real problem on which we need to work. And a problem I would like to notice is also the prevention. We need to develop a stronger system of prevention in our healthcare. Many of the diseases we have, we can prevent them. But to prevent, we need good education, communication, and investment on that. And the prevention, the protection of our environment is important for this prevention. Yeah, for prevention, we can also save money, and to put this money maybe in training and in our equipment, if we just do correctly the prevention. So it is important to focus on it. And the training, as many of you already told, we need to train even students, even physician, and even nurses, and everyone who is working in health sector. It is really important, and we need to open the door to private sector to train doctors, to train nurses, and people working in health sector. It is not supposed to be only a government problem. Yeah, the government that allows people to open some school, medical school, and to train. So we need training. And we need to improve the technical platform. Yeah, our platform needs to be improved. If we don't have a good platform, even if you have the best physicians in the world, they can do nothing if they don't have materials and equipment to work properly. This is a structural problem that we need to work on it, and we need to invest on it. Yeah. And we need also to improve the situation of nursing staff. As I already told, the salary, the compensation for them to just work on what they know correctly. Yeah, so we can have doctor at any time doing what they know to do better, to do the best. That is also a real problem on which the government and its partners need to work. And we need also to create a health insurance for everybody. I think that this can be a kind of a big dream, but I think we have the right to dream, and it will be important to support the healthcare fee for the population and for people in need. I think it is really, really important. So I think that can be the perspective we have for these tremendous and huge challenges in our health sector. Okay, I don't know if there are some questions or some preoccupation for the participants.
No question in chat so far, but if you have any question, please just unmute and ask. And we are very much looking forward also to your experience from the refugee camps in 2013, not only, but I guess that you are just getting to this right now.
Yes. The second the chapter on which I want to talk is my little experience in IDP camps. I think, as you know, on December 5, 2013, we had a great problem in the Central African Republic. Yeah, when rebels took the power, things going worst, and we have Seleka and Anti-Balaka. I think maybe you learned about it yesterday or the day before. Yeah, and people left their homes to go in the mosques, to the church, in the church, to protect, to look for protection. And it was my case too. Yeah, I left my home on December 5 to go to Notre Dame du Mont Carmel in Bimbo. I think just in the area next to Bangui, where there are some priests from Carmel. Yeah, I think for the Father Aurelio, we talk on it tomorrow. So in this congregation, I know well who work with Cédric and who helps to support a part of my study too, thanks to Cédric organization. I go there with my brothers. Yeah, 3 of my brothers. We went to the Carmel in this IDP camp. It was not an IDP camp before December 5, but in that day we have a lot of crime, a lot of shootings, and it was just incredible. I was with my brothers at home because they left their homes to come in ours, because their homes is just behind the Notre Dame de Fatima parish, a church which was attacked twice during this war, and they left and they come to join us. And just at home, we have rebels in the quarter. They came and they killed, unfortunately, a teacher just behind of our house. So we was terrified, and we ran and left the quarter to go for protection in Notre Dame du Mont Carmel. So once there, people continue to come. Because, as you can see on this picture, they have a large space with palms and a beautiful space. Yeah, so people come and for a lot. And in this congregation, in this convent, we try to do our best, to do really our best. And this is an opportunity for me to pay a tribute with to this community, yeah, of fathers of Carmel, yeah, that who did a lot, even if they did not have drugs, they did not have support in the first days. Maybe 1 month we were stuck with more than 15,000 displaced people. And spontaneously, we have pregnant women because they run, because we have many guns shooting. So many of them need to deliver baby. And it was just crazy. So we used to transform the refectory of these priests to a delivery room. And I use sometimes help by priests to deliver baby, and this during the day, at night as well, every time, and it was really crazy. But we did amazing thing with modest means, with modest equipment. We just have the little pharmacy of this priest, and we try to do our best. So we transform the refectory into delivery room, and we try to check patients every day. And for more than 2 months, I was stuck in this community, and before the NGOs came to our help, because in this time, some NGOs, many NGOs did not have the authorization, were not allowed to come in some sectors because it was dangerous and risky for them. And even from some European or American people, it was difficult for them to go to some areas because of security issues. So we have to work a lot with these priests to provide healthcare, to check patients, and most of them were seniors, pregnant women, and children. And we lost also some patients because we didn't have many things to do. Because when many people gathers like that, we have many issues that occur, like sanitation problem, lack of drinking water or food, and it was horrible. It was horrible. And during this time, I understand that we need to do something to prevent these kinds of situation. Any child need to come to the world by this way. It was traumatic. It was traumatic. And on the last week of January, we tried to have some support from some NGOs that came with some drugs, some people, some physician or nurses to help, but for just a short time. And at this time, I can now sleep a day because they are there. They can walk. They cannot walk at night, but at night I need to be to stand up and to walk because there is no one. So we try our best to help people in this tough time during which I was in that time. I was just a medical student. I finished my training, but I complete my training, but I didn't get already my graduation. So yeah, we try our best, and it was an experience, a great experience of my life. That's what I can talk about this experience. I don't know if there is a question about this experience already before to move on.
Thank you very much, Cédric, for sharing this. I guess there might be some questions already.
Okay, let's continue.
Yeah.
Yeah. And when NGOs came in this IDP camp, they wanted to hire me to work for them, and but I said no. I needed to go on some areas we didn't have NGOs or support. So I went back home, and at home, I tried to work in Notre Dame de Fatima Parish, another church just near to my, close to my house. And I continue what I did in Mont Carmel. Yes, I try to help pregnant women to deliver babies, especially at night, because at night it was impossible to join the health center. That is why I talked before how we can make a reform of our health care sector. Yeah, because during crisis or during war, it was very, very hard. It was harder to help people and to join the principal healthcare center. So I try to work at night on sometimes some UN soldiers have to come and bring me at home and to go to the church and to work and to help a pregnant woman who needs to deliver a baby. That's to say that the situation was terrible, was horrible and difficult. And we continue to take patients and to care people, and we face many challenges like lack of drugs and material, lack of drinking water and food also. And in this center, I try to set up peace building activities with some young people working in this parish, because we try to understand that we can do everything, but if we didn't have peace, there is not a solution. It will be a vicious cycle. We can go to the IDP camp today, come back the day after, and go back to the IDP camp every time if people don't need to build the peace and to work together. So we try a mediation work, and we try to listen to the people, because in this time people needed to be listened. And I think that was one of the trap in this situation. We got many support for abroad, yes, and I'm very thankful, grateful for that. But I think the situation was not really understood. Instead of soldiers, we really need at this time for psychology specialists on psychology to work, to listen to people. If in the beginning of this war, we had people to listen to those who lost their parents, who lost their children, their husbands, or their wife, or who lost their houses. We could save the problem earlier, but instead of that kind of support, we got soldiers, and when soldiers are there, they could not stop the process because everything was on the mind and on the heart of people, and soldiers could not do something against that. That is why it was like a kind of a drama of waste of money and energy and potential. Yeah, the real problem is that, and I think people try to understand it, and we got the first department of psychology just in 2014 in our university, because there is a lack of people working in the psychology area. And I think that is also a field on which we need to work very hard. We need to work and to prevent conflict and to solve a problem. So we did some sensitization and even a movie called The Dove. Yeah. Through this movie, we try to explain that it was not a religious problem, because people took the problem like a religious problem among Christians and Muslims, but it was not that, because our religious leaders, imams and bishops tried to work together and to sensitize people about this kind of misunderstanding. And we did many things, and we tried to make people to work together and to understand that it was a political and an economical and also a strategical problem. Yeah, the problem is not religious, but it is a strategical, an economical and political problem. And people try to use religion and to use division to create a big problem among Central Africans. That is what we try to do. And I think we have a movie. I shared the link with Eva. I don't know if you have it, John, we try to show something about this experience. It can be a good possibility for the participants to see what people try to do. And that's what I want to mention too, because during this difficult moment, we try to see many people in Central African Republic who try to do their best to save the situation and to make the situation going better. Maybe there are many times they are forgotten by the large public or by international community, but we have people in silence who work hard also to contribute for a sustainable solution to this country. And that's what I would like the participants see also, the endeavors of the local population, even if it is not enough. We need more support and to do more, because the problem is so deep, and but we have some kind of hope, and I stay optimistic that we can improve the situation in the country. Yeah. Do you get the link? Because from my side,
I think if this is it's NDF Bangui.
Well, yeah, NDF Bangui. Yeah. And you can see some movies.
Shall I share it?
Yes. So I'm going to stop my screen.
Okay.
Yeah.
Or will you share? It's up to you. I can share also. So.
Yeah, you can share. I think from your side it will be easiest. Yeah. Okay. So it is, for example, a picture of sensitization, raising awareness on peace building we did. Could you go down? Yeah, we can see the arrow de Fatima. Yeah. I think it is subtitled in English, so yeah.
Can you hear the sound?
Yeah, we can.
Cette paroisse s'est vue imposer une série noire de 2014 à 2018, alors qu'elle abritait plus de 5000 personnes déplacées par le conflit armé. On parle des héros de Notre-Dame de Fatima. Comment comprendre les tueries cycliques à cette paroisse? Comment la communauté chrétienne de Notre-Dame de Fatima a-t-elle réagi face à ces tueries pour à chaque fois remettre de ses sangs? Dans quelle perspective? En quoi sont-ils considérés comme des héros? Tout a commencé le 27 mars 2014, où il y a eu des coups de feu à une place mortuaire.
C'était vers 22 h où tout le monde dormait. Nous entendions des bruits. Si c'était des tireurs professionnels, la situation devait être plus grave. Ils avaient maladroitement largué 2 grenades à nana anti-char, accompagnées de tirs de Kalachnikov. Les tirs allaient dans tous les sens. Quand je me suis relevée, j'apercevais de la foule.
Sorry, some people told me it's not very loud, so I will try to start once again. It's probably on my side, so I'll try to do it once again. Should be okay now.
Et me rappelant de ce qui se fait dans les films, je suis plaquiste au sol pendant qu'il larguait les grenades. Et là, je criais, Jésus Sauveur, sauve-moi. Archange Michel, viens à mon aide. Étant veuve qui pourrait veiller sur mes enfants si je devais succomber. J'étais déjà atteinte d'une grenade, impactée au niveau de la colonne vertébrale. Ceux avec qui j'étais sur la natte étaient déjà tous morts. Je restais immobilisée, invoquant Jésus, Archange Michel. Et je voulais me rassurer de l'attention des autres, c'était ignorer que tous n'étaient que des cadavres.
Dans le 28,
Le 28 mai, j'étais à mon atelier. Mon atelier de menuiserie n'est pas loin de la paroisse de Fatima, à une distance d'au moins 150 mètres quand on vient de kilomètre 5. Quand il venait à Fatima, je travaillais avec mon équipe dans l'atelier. Quelqu'un était venu nous informer qu'un groupe de commerçants de kilomètre 5 se dirigeait vers la paroisse de Fatima, qu'il était préférable de tout fermer et partir. J'étais pris de panique. Je n'ai pas suivi une quelconque formation militaire, je ne suis qu'un commerçant. Nous avions tout rangé à la hâte. Cependant, certains de mes employés restaient encore dans l'atelier. En sortant, je me suis retrouvé en face des assaillants. J'ai échappé à leur tir qui a impacté la porte. Un de mes employés qui voulait sortir a reçu une balle, alors que je me suis sauvé derrière l'atelier. Par la grâce de Dieu, la balle a traversé son pied gauche pour se loger dans le pied droit sans toucher sa veine. Puis tous les deux, nous avions fui. J'étais préoccupé par son état vu qu'il était sous ma responsabilité. Et dans notre fuite, il s'est écroulé. Des gens de bonne foi avaient aidé en le transportant vers la paroisse de Fatima. Avec l'avancée des assaillants, ceux qui étaient avec moi dans la paroisse m'avaient fait sortir de la paroisse pour me retrouver au quartier. Ensuite, on m'a emmené à l'hôpital communautaire. J'ai été prise en charge par la Croix-Rouge internationale.
Les attaques n'étaient pas seulement contre les habitants de Fatima, mais également contre leurs maisons et leurs terrains.
Ils avaient incendié les maisons avec des produits à base de gaz, contenus dans des boîtiers appropriés, qu'ils utilisaient de maison en maison. Et dans ces maisons brûlées, ils ont retrouvé des boîtiers qu'on a conservés. Cela pourrait nous servir de pièces à conviction. On voyait de la fumée à 200 mètres. Avec des voisins, on observait la scène. Vers l'église de Kina, il y avait aussi de la fumée. D'après ceux qui cohabitaient avec les assaillants, c'était pour eux une erreur de procéder au pillage. Pour les fois passées, ils nous avaient pillés et l'on s'est réfugié à Bimbo pendant 2 ans. Nous sommes retournés ici par rapport à l'arrivée du pape. 3 mois après le départ du pape, ils sont revenus cette fois-ci pour tout incendier. D'après les dires, les pillages étaient une mauvaise stratégie. Ce qui est mieux, c'est de brûler les maisons. Ceux qui ne pourraient plus reconstruire leurs maisons pourront leur vendre leurs terres. Ainsi, ils occuperaient le kilomètre 5, Kina, Fatima, tout le secteur pour en faire le leur. Ceux qui ne pourraient plus reconstruire leurs maisons pourront leur vendre leurs terres. Ils traversaient le quartier Makambo pour déboucher sur Kina. J'étais allée découvrir ma maison en feu. Quand la situation s'aggravait, nous avions délaissé notre maison dans l'espoir de revenir plus tôt. Un soir vers 19h, un de nos voisins m'avait appelé pour m'aviser que l'on a mis le feu à ma maison.
Le 1er mai 2018, une autre attaque plus sanglante avait lieu en pleine messe. Ceux qui étaient là avaient connu l'horreur.
C'était à la fois grave et triste. Vous savez, quand les gens viennent pour prier, avec quoi viennent-ils? Juste la Bible, le chapelet, ou bien quelques livrets de prière ou de méditation.
Nous n'avions pas forcément compris ce qui s'était passé lors de la messe. Parmi ceux qui venaient de kilomètre 5, certains venaient à pied, d'autres à moto. Ils avaient ouvert le feu en pleine messe. Après le premier tir, la prière se poursuivait. Puis le deuxième tir nous inquiétait davantage. Étant habitués aux détonations, nous sommes facilement traumatisés en face de pareilles situations. Les prêtres nous ont dans un premier temps calmés, puis la messe était arrêtée. Cependant, certains continuaient de faire du chapelet. Toute issue de sortie était occupée par les assaillants. Ils avaient encerclé toute la paroisse. Ils avaient encerclé toute la paroisse et commencé à larguer des bombes lacrymogènes, ensuite des grenades, enfin des roquettes. Heureusement, les roquettes lancées ne s'explosaient pas. C'étaient les grenades qui avaient causé le plus de dégâts. Des seins de certaines femmes étaient arrachés, mais moi qui vous parle, j'ai été touchée par une grenade. Je recherchais quelques membres du mouvement Saint-Joseph pour avoir des informations. Un membre racontait qu'ils avaient fui dans la salle. Dans cette salle, il y avait une maman avec son bébé qui pleurait. Il avait aidé à s'installer pour allaiter le bébé. Après cela, il ne savait plus rien puisqu'il s'était retiré pour prier, m'a-t-il expliqué au téléphone. De là, nous étions restés sans nouvelles. Plus tard, j'étais appelée par ma nièce vers 17h pour nous rendre à la morgue. À la morgue, il y avait déjà là quelques membres de la famille. Voyant un de mes petits frères attrapant la paire de souliers, j'ai réalisé que mon frère désiré était déjà mort. Cela a fait que j'ai eu beaucoup de plaies partout sur le corps, même aux poumons, aux mains, aux cuisses et les pieds ont explosé dans ma paire de souliers. Arrivé à la paroisse de Fatima, il a posé ses éléments. Avec les assaillants, ils se sont échangés des tirs. D'après les témoignages, il avait protégé les fidèles. Il repoussait les assaillants jusqu'à court de munitions. C'est là qu'il a reçu une balle mortelle dans le dos. Le lendemain, à la morgue, nous avions compris comment il a été tué. Il avait la gorge traversée par une balle qui lui sortait derrière la tête. C'est tout ce que je sais. La mort de l'abbé Tongoma Baba n'est pas seulement une perte chrétienne, mais aussi pour les musulmans, parce que l'abbé Tongoma Baba était avec nous depuis le début de cette crise. Nous, les jeunes du 3e arrondissement jusqu'à Boeing, il œuvrait beaucoup pour la paix. Nous étions fort surpris quand on a attaqué la paroisse de Fatima avec comme cible l'abbé Tongoma Baba. Vous voyez, je parle de certaines manipulations de ceux qui ne veulent pas le retour de la paix. Car c'est un système permanent de confrontation.
Malgré Malgré ces drames infligés, la communauté chrétienne de Notre-Dame de Fatima a fait preuve d'une résilience particulière.
On a eu à proposer aux jeunes la formation sur le leadership, à être comme un modèle pour les autres et à lutter aussi pour que la paix puisse revenir dans notre pays. En étant jeunes, nous devons continuer toujours à se former, à s'auto-former. C'est ce qu'on a pu inculquer à notre jeune, surtout la formation. C'est ça qui fait la force de l'avenir de notre pays.
Au regard du sentiment de vengeance qui animait certains déplacés, les jeunes de la paroisse vont mettre en place un service d'écoute et d'apaisement.
Vous savez, les déplacés étaient venus sur le site des déplacés avec des sentiments de haine, de violence et de vengeance. Et nous, en tant que jeunes, puisque dans notre mission, c'est d'aider ceux qui ont des problèmes, nous avons cette mission-là de venir à côté d'eux pour apporter quelque chose. Et lorsqu'on était venu auprès d'eux, on s'est rendu compte qu'ils étaient dépassés de tous ces sentiments. Et la seule chose qu'on pouvait mettre en place, c'est de les écouter et de voir dans quelle mesure les aider pour qu'ils sortent de cette situation. Cette expérience nous a permis de comprendre que aujourd'hui, lorsqu'on est face à une situation, on peut avoir un autre comportement. Mais lorsqu'on est apaisé, on peut avoir un autre comportement. Et ceci nous a amené à voir clair avec nos frères qui ont commencé peu à peu à être adoucis pour passer à une autre étape qui est l'étape de changement et de marche.
Plus que des services d'écoute, les jeunes de la paroisse Notre-Dame de Fatima vont réaliser La Colombe, un film pour plaider la paix entre les communautés.
Ce film est le fruit de cette écoute-là. Parce qu'on avait démarré par les écoutes, on s'était rendu compte qu'il y avait l'esprit et les sentiments de haine et de vengeance qui étaient là. Et pour faire partir de ces sentiments, il faut mettre en place des activités. Et l'une des activités était ce film La Colombe qui pour nous est un message qu'on devait lancer très haut et fort, même au-delà de nos frontières, pour sensibiliser à la paix. Parce que le message fort que nous pouvons retenir de ce film est que nous voulons amener les gens à réfléchir sur ce que c'est que la justice pour ne pas penser à ce que la vengeance ou la violence est la maître solution à toute chose. Vous savez, le film, c'est un moyen de loisir aimé par beaucoup de gens. Et par ce film, on a mis en scène des réalités concrètes. Puisque dans le film parlait d'un jeune chrétien et un jeune musulman. Puisqu'on a tendance à nous amener dans cette crise qui étant une crise interreligieuse, nous, jeunes de Fatima, avions compris cette histoire-là. Et c'est pourquoi nous avons mis en place ce film pour essayer de sensibiliser, puisque la question de haine, la question de violence ne résoudra pas le problème. Puisque tous nos problèmes, on peut les résoudre si on cherche les vrais, comment je pourrais dire, les teneurs ou bien ceux qui sont la cause des problèmes pour nous permettre de sortir. C'est pourquoi on a voulu mettre en place ce film qui pour nous est un moyen qui permettra même de sensibiliser au-delà de nous, puisque si c'est à notre niveau, ça va être limité, mais un film peut partir même au-delà de nos frontières. Au départ, pour nous, c'était pas facile, mais quand nous nous sommes mis, on s'est rendu compte que tout était possible. Certains jeunes ont amené leur caméra, d'autres ont apporté leur ordinateur, certains ont apporté leur expertise, d'autres ont apporté leur expertise en montage, et c'est ce qui a fait qu'on a réalisé le film. On peut vous dire aujourd'hui que c'est la contribution des jeunes eux-mêmes pour mettre en place ce film.
Initialement, j'habite le quartier Béarex, mais avec les événements dramatiques, nos maisons ont été détruites. Je me retrouve derrière Saint-Jacques, mais pour des questions d'habitude, je suis restée fidèle à ma paroisse Fatima. Ce qui me fortifie et m'encourage à venir à Fatima, c'est la grâce de l'Esprit Saint. Il m'a ôté la peur et je ne peux aller nulle part. Je préfère rester fidèle à ma paroisse, bien qu'il y ait beaucoup d'églises à choisir. Je ne suis pas effrayée. Même s'il y avait des drames chez moi, je continuerai de venir prier ici.
La particularité de chacun de ces forums était que nous, c'était un moyen d'aider nos jeunes à se relever. Parce que pendant les forums, ce sont des moments de partage, ce sont des moments d'écoute. ce sont des moments de loisirs et ce sont des moments de renforcement spirituel. Et donc pour nous, la particularité de ces forums était d'amener nos jeunes à ne pas tomber dans les mêmes erreurs que les autres, mais de se tenir toujours debout pour marcher de l'avant.
Le prix mondial de l'humanisme de la jeunesse, remporté par un jeune de cette paroisse, apparaît comme un symbole d'espoir pour la suite des actions de paix entreprises par cette communauté.
Aujourd'hui, pour nous, en général, et pour moi en particulier, c'est un feu vert. C'est comme un feu vert de la route qui s'allume pour nous dire que, alors la route est ouverte, il faut continuer. Aujourd'hui, docteur Cédric, c'est un jeune qui a pu faire de tout son mieux, qui s'est toujours donné, au-delà de la crise, d'accoucher les mères au moment les très difficiles, sous les armes qui étaient là. On croyait que personne ne regardait, mais ça nous montre aujourd'hui que tous les efforts faits ne sont pas vains. Il y a des gens cachés qui regardent aussi les choses réalisées cachées. Et pour nous, c'est un autre défi qui s'ouvre à nous. C'est un défi d'éducation, c'est un défi de formation, c'est un défi d'accompagnement, c'est un défi qui doit nous aider à aller de l'avant pour acquérir tout ce qu'on veut. Le prix n'était pas pour Dr Cédric seul, c'était pour toute l'équipe, c'était pour tous les jeunes de la Fatima en particulier, mais en général de la République centrafricaine, qui essaient toujours de réaliser quelque chose et qui ne sont jamais rémunérés à la tâche.
Pour ne plus revivre ces drames survenus de 2014 à 2018 à Fatima, les victimes, les représentants de l'Église, ceux de la communauté internationale et ceux du gouvernement centrafricain proposent quelques pistes de solutions à observer.
Ce qui est passé est passé. Je demande à mes compatriotes centrafricains de tourner la page et à aller de l'avant. Nous attendons beaucoup des autorités. Notre pays est un pays indépendant. Nous demandons au président de la République et au gouvernement de veiller sur nos frontières, surtout le ministère de la Sécurité publique et de l'Intérieur, de revaloriser nos chefs de quartier, puisque c'est dans les quartiers que l'on retrouve de tout, afin de renseigner sur des intrus. Cela aiderait beaucoup à sécuriser notre pays des dangers d'infiltration étrangère.
Quant au vicaire général de l'archidiocèse de Bangui, il faut savoir réagir dans un état de droit.
Heureusement que Dieu est là dans notre histoire pour nous aider justement non seulement à supporter, mais je dirais à donner un sens positif à tout cela. Ça semble un peu bizarre ce que je dis, mais c'est important parce que Jésus a souffert, il est mort, mais le sens positif, c'est-à-dire Dieu l'a ressuscité. La question n'est plus de savoir quelle est l'origine du mal, mais quelle est ma réaction, mon comportement, ta réaction, notre réaction à nous quand le mal est là. Comment le combattre? Comment justement mettre en place des perspectives d'avenir pour que de pareils crimes ne se reproduisent pas? Il y a plusieurs pistes de solutions. Certes, nous vivons dans une société, dans un pays régi par une constitution. Et donc il est question, à mon avis, d'appliquer les termes même, le contenu, les mots de cette constitution-là. Parce que la constitution garantit le vivre ensemble. Quand il y a un vol, quand il y a un meurtre, quand il y a un assassinat, etc., notre loi, notre constitution nous dit comment faire.
Pour la ministre de la Défense et de la Reconstruction centrafricaine, la sécurité du pays passe par la formation et le redéploiement de l'armée centrafricaine.
La valeur d'un pays dépend de la valeur de son armée. Et c'est l'objectif que nous recherchons aujourd'hui à travers la formation de nos hommes. Nous avons beaucoup de jeunes qui ont déjà été formés, qui commencent à être redéployés dans notre pays. Nous en recrutons aussi parce qu'on a taxé notre armée d'une armée monocolore parce qu'on dit que c'est une région qui est dominante par rapport à d'autres. Aujourd'hui, comme vous le suivez, nous faisons les recrutements des jeunes dans tout le pays. Nous voulons une armée nationale qui soit au service de notre pays, une armée qui doit protéger la population, une armée qui doit défendre le territoire. Donc après les formations, on doit équiper nos militaires. Et par rapport aux orientations du chef de l'État, au lieu qu'on garde l'armée à Bangui, ils seront rapprochés de la population. C'est ce que nous appelons les garnisons. Donc nous allons redéployer l'armée un peu partout dans notre pays, dans les garnisons. Il y en a 4. Une à Bangui, bien sûr, une à Boire pour tout l'ouest, une garnison en Délé pour le centre et une garnison à l'est à Bangassou. Donc nous devons les redéployer dans toutes ces garnisons pour être plus proches de la population et répondre à leurs sollicitations.
Pour l'ambassadeur de la CEEAC, il faut passer en revue les recommandations du Forum de Bangui.
C'est-à-dire tout faire pour la cohésion sociale, tout faire pour le développement, tout faire pour l'intégration de la femme, tout faire pour la promotion de la jeunesse. C'est sur ce programme que la CAC va continuer à appuyer, mais comme je dis, nous l'appuyons dans le cadre du gouvernement et dans le cas précis de Fatima, nous allons plutôt travailler avec les autorités locales parce que c'est pour essayer de trouver des solutions à une crise relativement localisée.
Nous enseignons aux frères et sœurs de s'abstenir des rumeurs, car lorsqu'on ne connaît pas les causes d'un drame, ce que l'on dit peut mettre de l'huile sur le feu. Le plus important, c'est d'aider les enfants à revenir à l'école. Qu'on responsabilise les jeunes, car si l'on est instruit, on ne peut pas agir avec barbarie.
Cadre de ressourcement spirituel et d'œuvre sociale, devenu camp de déplacés internes puis victime de plusieurs attaques armées, la paroisse Notre-Dame de Fatima de Bangui est restée debout grâce à la résilience de ses filles et fils qui, dans un élan de foi et d'humanisme, n'ont pas baissé les bras dans ces moments sombres. Riche de son vécu, elle continue de renaître de ses cendres et se veut aujourd'hui être un lieu symbolique de prière, de formation humaine, de recueillement et d'échanges culturels et religieux entre les peuples, en proposant des séries d'activités pour la population. Un élan qu'elle aimerait voir grandir davantage, aussi bien au sein de la population centrafricaine qu'au niveau des autorités politiques et religieuses du pays pour la sauvegarde de la paix tant souhaitée.
Si le pays est sécurisé, il y aura la paix et tout redeviendra normal.
Thank you, John, for your assistance.
Thank you very much, Cédric. And as our participants and students probably have recognized, there was a very interesting man mentioned in in this movie, and very modest man who didn't mention this on his own. So you probably noticed that there was Cédric mentioned and shown in the movie as a winner of the World Prize of Humanism. So. I forgot to mention this also in your introduction at the beginning, but you are a man of many virtues and many awards. So just for everyone to mention that there was Cédric mentioned in the document.
Thank you so much. I think maybe after the break, we will talk a little bit about about myself and what I can share maybe with participants, and also listen for their impression or their suggestion. We continue to work, so that is important to have also a feedback people living in other areas with other challenges, so they can give also their point of view to help us in our daily work. Okay, yeah. If I can come back to the movie, I think it is very fast, but we did it in what we have. But I hope also the participants try to understand. I just wanted to show that while we are going through a difficult moment, difficult situation, we have many people locally who are engaged, and mostly young people, to hope for better days, for the development of their country. And I think that is a great reason to continue to believe that it is possible. And this movie, after the first one, we try to continue with young people to work on peace building, because it is really important. And after that, young people continue to produce and to show themselves, because one of the problem in our context, in the crisis, in car crisis, is that Central Africans don't have the possibility or the opportunity to talk themselves about this problem. Most of the time, people from different areas talk from them. It is not bad, but sometimes it is important to hear what they think, what they do, and to better understand also the situation. So that is why we do. And what you see is possible also because as a physician, yeah, this is something to notice. In Central African Republic, as a physician, you can have an important impact on the population, because I used to treat not only Christian, because if you see a parish today, because we just have this movie, but we did many things in different areas, even with Muslim and with everybody. But if you are a physician, and that is the same thing everywhere, you have to see every people, every person, regardless his religion, his color, his faith. Yeah, that is what I try to do. And I even had to care rebels, people in need, people from different sides. So during my checking or consultation, I used to talk with them and to understand why you want to kill others. And during the conversation, yeah, I try to understand more their motivation, and I try to convince them. That is why I try to be involved in peace building also, because I think that it is the same thing. It is peace building can complete what I'm doing, or medicine can complete the process of peace building, because if we have peace, we can do everything, and we can work on the development. And another problem that we want to show through this movie is that is the impunity. Yeah, this is people do many things in the country, but they are not put to the jail. This is horrible because people think that if they use their gun and their gun or strength to do violence to get something, after that everything can continue like that, and so they are encouraged to continue in this bad habits and to trouble others. So I think one of the challenge is also to work on impunity to set a real justice system. So even in the health sector, people can work correctly because they know that if they do something, there is impartial justice for everyone, even you are poor or even you are rich. Yeah, that's a little comment I can add on this movie.
Thank you very much, Cédric, for this message and also for the entire morning. And I think we have all got a lot of food for thought for the lunch break.
Okay, for the lunch break, yeah. Okay.
But if this is in line with your timing,
okay.
It
is okay with my timing. Yeah,
I think we all can think about this and reflect and maybe come with some questions, and maybe some questions will arise during the lunch break, and then there is the afternoon starting at 1 p.m. in 1 hour. Okay.
Yeah. Okay.
Are you fine with this?
Yes. Yep. I'm fine. I'm fine with that. I'm going to share some questions so we can
Good.
Yeah. Okay.
Thank you very much, and we are going to reconvene here in 1 hour then.
Okay. 1 p.m.
Yes, in 1 hour.
Right. Thank you.
Bon appétit.
Merci beaucoup à toi aussi.